This is a very difficult time for all Lebanese people going through the coronavirus pandemic after the financial crisis. Stress has increased a lot lately, and at the same time, the coronavirus pandemic did not make things any easier. For people who tend to be anxious in general, this anxiety level might be a little bit higher than usual. But most of us right now are in this phase where we are trying to be a little bit safer and practice better hygiene and be careful. It's very normal if we're a little bit more concerned about our health and we're trying to be a little bit more obsessive about hygiene in general. However, some people who tend to be a little bit more or are probably more struggling in this phase are those who suffer from contamination-based OCD in the first place. So such people tend to be more affected during periods of disease and infections because in the first place their anxiety is about contamination. So there is a higher possibility for them to over worry and to engage in checking their cleanliness and their hygiene behavior multiple times. Sometimes this can be very difficult to control and even frustrating. Other people might be worried about their health, especially if they suffer or struggle with what we call hypochondriasis or health-related anxiety. Such people can suffer from anxiety more than the average population when they have some physical symptoms because they tend to attribute those physical symptoms to a severe illness. In such a situation right now, if someone is coughing, for instance, or if a person is having difficulty breathing, they might actually interpret this as a possible symptom of the coronavirus infection, which possibly could be, but it's not enough to do the diagnosis with just one or two symptoms. So in this period of time, it's very important for any person seeking professional help to continue seeking this help. And it's advantageous for mental health professionals because some of the therapy sessions or treatment sessions can be done remotely via Skype or WhatsApp video calls or even a regular phone calls. So that's a bit of an advantage when it comes to the field of mental health. We need to follow the guidelines set to us by the World Health Organization and by the Ministry of Health in Lebanon. And if we are just taking basic measures of safety and hygiene practices, we should be okay. Have a great day.